Um, Bundle payments. Now, if we think about bundle payments and the contracting and the monetary flows, then we see that there is, of course, a relationship between the provider and the payer, whether that payer is a health insurer or the government or whatever. But there is a payer-provider relationship. There is a relationship between the provider and industry. In the value-based healthcare field, industry is part of the team and should be part of the team and should also be rewarded according to outcomes, not to anything else. I know it's a hard thing, but it needs to be aligned. If it's not aligned, it's not going to work. So that's the contract, and there is a relationship between industry and payers, and basically we see on all three we see a development in sort of contracts. To put it a little bit simple, you say from a provider to a payer, we want to move to these bundle payments, outcome-based purchasing by the payers, and hospital contracting that allows for that, doing the right thing and get rewarded and paid for it. And we want, if you generate a lot of value, we want more of that value. We do not want to capitate you on what you do really well. We want you to do more of that for the right group. So that's quite a change in most countries to think that way. Of course, we want you to improve on what you're not doing well, or decide to organize it differently and play a different role in that delivery with the colleagues in the system. We want a relationship between industry and provider, where we see more and more movement of, let's say it's pharma or it's medtech, or it's diets, or it's maybe other things that are of key important in terms of the activities generating good outcomes. And if it comes from industry, we see fortunately this development of having the contracting and the payment much more related to outcome, whether it's outcome guarantees or even extreme as no cure, no pay. But we want more alignment in that element, and I know that certainly some of the leaders in industry are very anxious on moving on that path and willing to take that risk, but of course want to be fairly rewarded. And if it's not working, then don't pay. So I think that's a more healthy, mature relationship that sometimes, at least, we have an impression that is going on between industry and providers and patients. And then, of course, there's the relationship between industry and payers in terms of that can be more on a population, that can be on a value-based contracting, that can be on volume, and certainly the issue of what is, I think, coined wrongly, but that's the way most people talk about it, is expensive drugs. I would certainly say it's personalized medicine and it's the new ways of medicine. But we need to think about new contract ways that are beneficial for patients, that are doable for payers, and that are encouraging industry to come up with great, good solutions. And we all know that we need a different way of thinking in the bio-based drugs compared to the traditional chemical-based drugs. So we need new ways of thinking of it, and we do not want to ration what are now expensive drugs to only a limited number of patients. We need to come up with new ways of contracting those, and that is, I think, one of the key challenges that all healthcare systems face, and I think value-based healthcare can certainly be part of the solution.
Would you like to become a value-based healthcare expert and be recognized for your expertise? Follow the Value-Based Healthcare Greenbelt track. During the sessions, you will be trained to become a certified Value-Based Healthcare Greenbelt. Sign up now and distinguish yourself from others. Visit our website for more information.